Hi, this is Jacquelyn Ekern with Eating Disorder Hope, and I have the pleasure today of interviewing Brenda Velissaris. She is the founder of Evolve Healing, a phenomenal eating disorder treatment center in Wisconsin. And we are going to spend some time getting to know her today and learning about Evolve. Just so you know, Miss Brenda she's a licensed professional counselor. She also is a certified eating disorder specialist and a supervisor. She brings a lot of passion and heart to treating eating disorders, and I'd like to introduce her. Hi, Brenda.
Hi, Jacquelyn. Thank you for the wonderful introduction.
Yeah, my pleasure. So tell us about founding Evolve and how that came about and what the mission is and the philosophy.
Sure. So Evolve was really founded on a dream and a passion. In 2008, I broke away from a larger counseling facility and opened up my own private practice. And a lot of the patients that I saw, even though it was like a general mental health practice, I saw a lot of patients with an eating disorder. And I learned really quick that there were very limited resources in the state of Wisconsin for individuals that had an eating disorder. And I'm a fixer just by nature. And so I saw this huge gap in services and this large need, and then I wanted to fix it. So I created this dream that someday I would open up my own eating disorder treatment clinic to fulfill that gap. And so I saved money and planned and plotted and all this kind of stuff. And then I met with a dietitian at a networking meeting that we have here in our local community. We get together every other month, and I, out of the blue, never met her before, and I said, "Do you want to open up an eating disorder clinic with me?" And she said, "Sure." And then I said, "Oh, by the way, my name's Brenda." So that's really how Evolve started. We maybe took a year to, again, kind of figure out what our vision and our philosophies were and where we wanted to be located and what services we wanted to offer. And then in 2013, September of 2013, Evolve opened, and it was just myself and this dietitian. And then by January of 2014, we had our next therapist on board, and then we've been adding clinicians ever since then, because there really was a need, and we didn't realize how big of a need there was until it's kind of like that movie, if you build it, they will come kind of a thing, and realized just how big of a need for services there was. And we've been expanding ever since, to the point now that we're actually adding another location and extending our line of services to a partial hospitalization program.
Wow. That's amazing, incredible growth in a pretty short time. And what is the philosophy behind your care?
So we really believe in health at every size. I can't underscore enough how I want to really take away the stigma behind eating disorders and remove the shame and really kind of meet the individual where they're at and assure them that this is a disorder that is treatable and recovery is possible, and that you can be healthy at any size, that you don't need to fit into a particular mold. And I also like myself and all of my clinicians to be able to provide a very eclectic type of treatment that is evidence-based. So if something doesn't work for you, I want that individual to say, "This isn't working for me, can I try something else?" And to get them to pair up with a modality that is going to be a great fit for them, so they feel that they're well taken care of, and that we take this seriously, and they're going to get what they need, so they can get to the place that they need to be at.
The evidence-based treatment is so important and wonderful that you've emphasized that. And then the health at every size and body acceptance would be so healing for people, just to, sometimes for the first time, to be around that kind of a concept.
Yeah, it's really interesting when we present health at every size concept, individuals look at us like we have 3 heads. Like, that's really possible? Like, never heard of such a thing before. So we really love to provide a great deal of psychoeducation to not only that people that walk through our doors, but even in the community. I mean, I think myself and all of the clinicians, we're constantly talking about this to our friends and family and networking meetings, just to our own physicians. I have been known to carry a bunch of the Health at Every Size books with me, and then when I go or take my kids to the physician's office, I'll pass them out just to kind of spread the word that this is true and real, and we can break out of this real diety, disordered eating mentality of how we live.
Wow, it's very hope inspiring. So what is particularly unique about Evolve's program?
So I think what really makes us unique is that I'm a huge believer in education and training, and that a clinician can only take somebody as far as what they know. So I'm a huge proponent of getting certified, certifications and continuing education and expanding and growing as clinicians. And so what makes us unique is I do have a requirement that all of our clinicians are certified eating disorder specialists or certified eating disorder registered dietitians. And so either our staff hold those credentials because they've completed the training, or they're working towards it. And it's an extensive training, so it takes roughly 18 months to 2 years, depending on how much time the clinician has. So that makes us very different than other clinics, is that we hold this highest credential in the eating disorder community. And I'm also a supervisor, and our nutrition director is a supervisor for the registered dietitians. So we also offer this ongoing supervision, and I'm picky. I'm very, I like to make sure that we are giving the best quality care possible. So that makes us unique. And then in addition to that, yes, we use evidence-based practices within our organization, but any of our intensive outpatient program or group material was created by the staff and myself. So we've created our own curriculum. We have our own manuals and binders and module concepts for in our group programs. So this isn't something that we just pulled out of a book or that we just shoot from the hip. This is stuff that information and group programming that has been years in the making, and then refined and revised based on what our group members have taught us along the way as to what works and what doesn't work and what stuck with them the most. And we have alumni that come back, and I'm constantly asking, what did you like about your services here at Evolve, and what wasn't so hot? And I take that information to heart, and then we revise our programming based on that feedback. So I think that makes us unique as well, is that we are constantly growing and developing and changing our curriculum to make it the best that we can provide. Our curriculum is also very hands-on, so nobody is really sitting in a room doing paper packets or, read this book and I'll check on you in a little bit kind of a thing. We're constantly doing stuff with our individuals in our group. They might get a little worn out from us because we're constantly keeping them active. But I think that is the best way to provide services to our individuals. We also offer a lot of services for those individuals that have comorbidities. So if somebody has OCD and anorexia, we've got staff that can provide that care for them so they don't have to go to another provider outside of our agency. Treatment can be very time demanding, and so I like to be able to create something that was more of a one-stop shop. So we have the dietitians right in-house, we have a medical doctor in-house, we have the therapists in-house, We treat OCD and anxiety and depression and trauma. We have 2 trauma specialists on staff. Somebody that does IFS, so we have all of dance movement. We have an art therapist, we have all of these things right in-house, so they don't have to go anywhere. They can just show up, and then we can provide them the services that they need.
That sounds wonderful to have it all inclusive for both the families and the eating disorder sufferer, to not have to be going to appointments all over town and just be able to come to one location.
Yeah, I learned that really early on when I started my first private practice back in 2008, that people were running all over the place for treatment. And I thought that was absolutely maddening. I know I wouldn't be able to keep up with some of the stuff that my clients were doing. They impressed me by how dedicated they were to their treatment. And I thought, well, life can be a lot easier because, I'm a fixer, right? Life could be a lot easier if everything was under one roof, and then we could just do back-to-back sessions for them, and then they could get everything taken care of, and alleviate a lot of that stress and pressure, because I don't think getting help in the mental health field should be more stressful. It's supposed to be helpful. So that was kind of the reasoning behind my madness of making sure we had everybody in-house for those services.
The program sounds very well designed. And I know you have some different levels of care. How is the outpatient therapy structured?
So what I will say is majority of people that come to us start from the outpatient level of care. They're referred by their physician or a therapist that they're currently seeing, or a dietitian, or self-referral. And so our outpatient is really kind of the first line, where the screenings are occurring and the assessments are being developed to really figure out what appropriate level of care is going to be the best for that individual. If somebody stays within our outpatient care, we really cater or create a treatment plan to fit that individual's needs. That's also something that we really pride ourselves in, is not saying, well, this is how things are set up here, and this is, you need to fit into that mold that we've created. We're kind of like, all right, we understand that you need assistance, but you live a really busy life, and all you can give right now is a session every other week. So we're going to meet you where you're at, and that's what we're going to provide for you. And we're going to focus on what's the most important to you. So if that's, minimizing some eating disorder behaviors in the evening time, then that's what we're going to work on. And then we'll just kind of keep building based on where that patient is at or that client is at, and then continue developing their treatment plan as we go forward. So, go ahead.
I love the flexibility and the personalized approach to each individual that you're offering.
Well, yeah, I mean, everybody's so unique and they have different needs, and their headspace is in a different place. I might think that they need to be addressing 6 different things, but they're kind of like, hold up, I just want this one thing, and I'll lose them if I impose my agenda on them, and not let them be a huge participant in their care. One of my big philosophies is I'm just walking through your life, and I'm very grateful to be a part of this journey, but I'm not going to take over and say this is how it needs to be because I'm this licensed, credentialed clinician. I'll step in, and my staff will step in if we think, something is maybe not being very rational or reasonable. But we, at the end of the day, let the family and the client make the best decisions for themselves.
Just sounds like a lot of dignity for the client, which I know I would really value if I were in your program.
Of course.
I know you do some nutritional counseling also. Are those separate appointments in the therapy for outpatient, and how does that work?
Yeah, I mean, for a typical person in their outpatient, it's generally once a week with a counselor and once a week with a dietitian for nutritional counseling. If that's not enough, like if they're they're really struggling to get in between sessions, and they're just needing more support or more direction or more education. What we tend to do is maybe space those appointments apart, so they're always having a point, like a touch point with a staff person. So we might have therapy early in the week and then nutritional counseling later in the week. If that doesn't work, then we might up the level of care. Like now you're getting 2 therapy sessions a week and 1 nutritional session a week. And depending on the person's needs, if they're traveling very far, we'll try to double up on those sessions. But if we can get away with not having to double up on the sessions in the same day, we'd like to space them out. So now they're getting a therapy session at the beginning of the week, a nutrition session in the middle of the week, and a therapy session at the end of the week. So they're really bookend throughout the week and getting that support. And then if that's not working, then we'll increase that level of care maybe to an intensive outpatient program. So, and then we pull away services as a person doesn't need them anymore. So our outpatient services can, from a nutritional perspective, can be more like they're seeing the client every other week and then the therapist on the opposite week. So they're still getting that point of contact and point of care, but it isn't as intensive as it once was.
Sure. So if they go up to the next level of care, the intensive outpatient care, how is that structured?
So we offer an IOP, or intensive outpatient, 4 days a week, and it is for both adults and adolescents. Adolescents program is after school, so they can continue with school. It's 3 hours a day. So it's Monday through Thursday. The adult program is the same. It's Monday through Thursday, 3 hours a day, but it's in the morning time. So people start their day off with us in the adult program. We also have this other IOP program called Attuned, which focuses primarily on bulimia and binge eating. It's very dialectical behavior based, which is excellent for populations with the binge eating and the bulimia, and that's also offered in the evenings as well.
So Attuned kind of focuses on DBT and its application to binge eating disorder.
Mm-hmm.
Yes. And it's just in the evenings.
It's just in the evenings, yes.
That's wonderful. And I understand that there's a new PHP coming in December.
Oh, I know. I'm excited and scared at the whole time. So recognizing the limited services within Wisconsin and only being able to take our clients to an IOP level of care and then needing to refer them out a lot of times out of state, unfortunately. So I have just fallen into a wonderful opportunity to expand our levels of care. And so we're opening a PHP program in the De Pere area, which is about maybe 25 minutes north of where our Appleton office is. So again, not too big of a travel for those individuals in the Fox Valley, Appleton area, but also putting the partial hospitalization in an area that really has nothing available to individuals for an eating disorder. So we're offering PHP to adolescents and adults.
Wonderful.
Mm-hmm.
And how is that structured in terms of time commitment, and what kinds of groups and appointments would they have during the PHP programming?
Yeah, so our adult PHP starts at 8 in the morning and then runs until 2 p.m. We have designed it so that individuals in our IOP program will also be attending from 8 to 11, and then they'll just break away, and then the people in the PHP will continue on. It is a pretty structured program in that there are skill groups, there's psychoeducation groups, there's process groups, there's an IFS group, there's a trauma track if somebody, if people need trauma assistance. It's has built in 2 individual counseling sessions a week for the individuals and 1 individual dietitian session per week. There is exposure response treatment in that we do a lot of culinary skills work. So we'll have them cooking in the kitchen. practicing and exposing around food. We have field trips built in, so we're going to take all the skills that the individual has learned inside of our PHP office, and we're going to go to the grocery store and grocery shop, or we're going to go to the mall and shop, or we're going to, you know, have a meal out in a restaurant to get some of that exposure and utilize those skills. So everybody's going to be busy. The staff and the group members are going to be very busy. We have body and movement and art therapy as well as part of our program. So we have a yoga instructor that comes in. We have some dance involved. We don't have equine therapy on site because we're in the city, but we do collaborate with an equine assisted therapeutic program, and we do a field trip out there and we play with the horses, and I mean, you name it, we do it, and we provide it so that people are ready to integrate back into the community and face life, and with their new skills and their newfound hope and readiness for recovery. And our adolescent program just mimics our adult program, but it's from noon until 6:30. So the kiddos can go to school during the day and then just do our program. So all the same treatment modalities and exposures and groups and things are the exact same, just in kiddo version.
It's so comprehensive. It's nice that there's different aspects of addressing the individual's needs, and some things might resonate more with one client or another, but with such a diverse program, it seems like a very good fit for most.
Absolutely. And again, you know, in continuing with our individual theme, if somebody needs additional individual time, they will get it. We'll make sure that that happens. If they respond very well to art therapy, that's kind of their jam in expressing thoughts and feelings, we have built in extra art therapy time. They don't, you know, we can pull them out of, maybe they're really experienced with skills and they could write a book on it and they don't necessarily need to sit in that group anymore, then we can throw them into a art therapy group because that's going to be more advantageous for them and where they need to go. So the one thing is nobody can get out of process group. You know, everybody wants to get out of that one. That's the most tricky one, and that's a mainstay. So,
why is process group important?
Well, I think process group is important because it's a way for us to be challenged by our peer group and challenge our peer group and express our thoughts and feelings. And nobody wants to talk about that stuff, right? Nobody wants to talk about their struggle or how they were triggered at blah, 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 or because they don't want to hurt somebody's feelings or open up and be vulnerable or discuss something that's shameful. So yeah, if there's an opportunity to get out of it, people will take it.
But it's so essential because that's life and relationships. So I'm so glad that there is that opportunity to practice in the program, communication skills, confrontation, diplomacy, all the things that we need to use out in the real world.
Absolutely. I will say, you know, the group members will come back to us and say, thank you for making me go. I appreciate it, but they're never excited to go in the beginning. Yes,
I know. I don't know if we could ever have enough training for interpersonal relationships and communications. It's just evolved. I'd like to be in the group.
Right, exactly.
My last question for you is, who is an ideal candidate for eating disorder recovery care at Evolve Healing?
That's a very good question. I'm going to say anybody is an ideal candidate. If they're ready, if they call, if they show up, that's enough for us. We can fill in the, you know, whatever needs. So even if somebody is in like a pre-contemplative stage, like this is everybody else's thing, I am fine, we can meet them where they're at. You showed up today, so let's figure it out, you know, or you called today to, you know, pick my brain a little bit to see if this is going to be the place for you. Let's work with that. That is, to me, an ideal candidate. So I don't require really anything other than that. Just be here. Mm-hmm.
That's wonderful. So at all different levels of motivation of wanting recovery, you're a good fit for them.
Yeah, I say game on.
Brenda, I love your program and your spirit and joyful state of being is just really refreshing to be around. Thank you for sharing a bit about Evolve Healing's program today. We are honored to have you.
Oh, I appreciate it. Thank you for this opportunity. It was super fun.
All right, take care.
Bye.